Hello, my name is Amy Sturkey. I am a pediatric physical therapist. I'm here with Alexis Sanderson, and she has spastic quadriplegic cerebral palsy, and her cerebral palsy is caused by, here, let's hold this up. Here we go. Oh gosh. Oh, it's so tricky. All the way up. That's right, it's caused by, her cerebral palsy is caused by CMV. That's short for cytomegalovirus. So really, any infection that a mother is at risk when she's pregnant, when she has a baby. But there are certain viruses that are more likely to cause cerebral palsy in a child when the mother is pregnant with the child. So those are rubella and West Nile virus, Zika, chickenpox, and cytomegalovirus. And in fact, come on back up. Really, you have to worry about when a mother is pregnant and she has an infection or a fever, then her body, as she tries to fight the infections, her body releases cytokines, and cytokines are then passed from the mother to the baby. And the problem is when the baby has cytokines in her body from the mother, that causes inflammation, and that inflammation in the brain can cause damage to the baby. So CMV is the most common infection in babies when they're congenital infection when babies are born. And CMV is the most common infectious cause of central nervous system damage and sensory neural hearing damage in a child. In fact, I understand now that if a baby fails a newborn screen for hearing, that they start testing for cytomegalovirus because it's the most likely cause of sensory neural hearing loss in babies. So let's see what the next question is. Can you hold this right here? We have to hold it up again. Yep, we want to know the odds. Well, the odds of a baby being born with cytomegalovirus is actually pretty high. It's 1 in 200 babies have cytomegalovirus when they're born, which is a really high amount if you think about it. But for most babies, they say 90 to 85% are totally asymptomatic when they're born from the cytomegalovirus. Only 10 to 15% of babies when they're born have severe involvement from the cytomegalovirus. Of the babies that are born that had cytomegalovirus that were asymptomatic, so that's 90 to 85% of babies who are born with cytomegalovirus, those are the children that are born initially asymptomatic. But in 10 to 15% of those cases, later on they may develop hearing loss or central nervous system damage. So this is really quite a problem. It's become quite a problem, in fact, that, hold on right now, we gotta hide again, you ready? We gotta see what our next topic is. Can you hold your side? I'll hold my side. We gotta go sit up for me. Here, let's hold it up. What's the cure for cytomegalovirus? Well, right now there is no cure for cytomegalovirus. There are a lot of companies, in fact, looking for vaccinations for cytomegalovirus, but at this point they have not come up with any that help block or keep you from getting cytomegalovirus. So let's see. Well, let's talk about next. Hold on, we have to put up this. Yes, we do. We're going to put this up right here. Ready? We're going to hold it up again. Ooh. You want to know what does cytomegalovirus infection cause? Well, it can cause cerebral palsy. It can cause weakness. It can cause global developmental delay and intellectual disability. It can cause vision difficulties and hearing difficulties. So Alexis has cerebral palsy and the weakness and the hearing impairment. She has a cochlear implant to be able to help her hear. What they say is that most toddlers or adolescents pick up cytomegalovirus. And for most people, when you have the infection, when you're not pregnant, that it is asymptomatic for them. They may have no symptoms or a simple cold. Most adults have had some exposure to cytomegalovirus, but it is similar to COVID in that there are a lot of strains of CMV, and the problem is if you develop CMV for the first time to that particular strain when you're pregnant, if you don't have the antibodies, is when your baby is more likely to have problems. Let's talk about prevention. Our next topic is prevention. So how, at this point, since there is no vaccine, how do you prevent cytomegalovirus infections? So what they say is when you're pregnant that it's really important to wash your hands after you touch food, or if you're touching dirt or any animals, or if you're with children. Children are carriers of cytomegalovirus. So you need to, after you play with children, you need to wash your hands. You need to wash your hands, especially after being with people who are sick. You need to sit up. They say it's important for you to avoid unpasteurized milk, pet litter, rodents, whether they're pet rodents or otherwise, and any kind of wild animals when you're pregnant. And then they talk about just the importance of making all your regular appointments when you're pregnant. And then if you have any symptoms when you're pregnant of a flu or a fever or a cough or rashes, that it's very important to go to the doctor just to make sure that if you are getting a cytomegalovirus infection, that it's handled well so that there's limited cytokines that are spread from you to the baby. We're going to finish this video off with, let's lift it up one more time. You ready? You gotta have to hold it up high. Here we go, hold it up high. The end, because that's it. I hope this information on cytomegalovirus is helpful for you, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.